Hello, I'm Chris Nield, consultant in public health with NHS Sheffield, and I have a role with the public health workforce advisory group, which really got me involved in the making every contact count, along with my main remit, which is about leading for the healthy communities work across Sheffield. I think very initially we were looking at it as particularly for the PCT and looking at it organisational development, but also with individuals in the organisation so that they would have a public health role for themselves, for their health, their family and people they came into contact with.
Right.
However, that changed significantly because the PCTs closed down, so organisational development. But some of the principles of that have still carried on through the other interventions we've now taken up.
Okay.
The idea of maximising staff role for public health, but also trying to influence other commissioning processes at a strategic level have been really important for us in what we've tried to develop. I think the thing that's really kind of captured the imagination in Sheffield and has really taken it forward a huge step was the Healthy Chat courses. And so having that training the trainers from region where people could, we could send people from HR departments across the hospitals and our provider services, but they were really keen because they could see how they could cascade that down, and NHS hospitals and departments could really own this idea of how can you really improve people's health, and what about your contact with them, what does that mean, is that going to make a difference, what other support might they need. So through doing that we started some work then, two particular departments of the hospital, cardiac as you might imagine, respiratory started with, but the children's have been particularly interested and they sent their HR staff on it to take that forward. Now since then, one of the other HR people who does a lot of work with City College and also the NHS, and he's really got the intermediate care services fired up about it. And they're he's putting on his own Healthy Chat training, the trainers for them. And they've really embraced it because they can think, well, this really adds quality to what we're doing. It was a new role in intermediate care for this particular band of posts. And they really wanted to make a difference to the people's health they were working with, but it turned up to be mainly physical and tasks, whereas really training them and perhaps a bit more of the coaching, not just the brief chat, you know, a bit more of the support to achieve it because they've got that bit of long-term contact, has really inspired them. They're going to have a launch. They're undertaking the training at the moment, so this is newly developing. And also with having the HR people there, using the framework and having the assessment tool makes a difference because they've got to look at the needs. And what needs have we got to make people really have the confidence and the capability to make these conversations. But I think there's been some misconceptions about it. So we've got a scheme called Healthy Living Pharmacies in Sheffield, and we're really working with them. It went into the original proposal, the idea of the making every contact count, the chat, that opportunity there. And I think at first the pharmacists thought, well, we must be at level 3. But actually, they probably just need the brief level 1, and it's their staff who may have a more sort of health champions, health trainers role that may need that other training and working at that other level, at level 3, to support the changes to happen. So I think they have been useful, but probably, you know, you have to challenge how they might be used. I met with the lead person in the local authority for all the points of contact that the local authority has with the public, and they really would like to train most of their staff so that in the Healthy Chat bit at least, and they also can see that in some of those places where it's a bit more of ongoing contact, you could even put a sort of more of a level 3 type support in there. And they really get that it is about having that capability and confidence to do it and the training. So we've been waiting for the Healthy Chat course. We're going to have a Sheffield specific one, because the other area that's really keen is social care and housing, because they have people like housing wardens and social care, people that go into people's homes. So training them as part of their induction or their general training to actually have that more meaningful conversation. It could prevent a great, people needing the hospital. It could support them to make changes they want. And again, like I said, with intermediate care, it really is good in terms of themselves, about their own health and the quality and the difference in their own job as well to do that. So we've got lots of irons in the fire with the local authority that's really exciting, and they get it, as Karen says, they get it, and there's an opportunity there. And we've already done quite a bit with the fire service, but the fire service, we've got some great contacts with, and they have they do a lot of home visits, preventative. So we've been training them for brief interventions, and they've already been doing some of it, but we've been training a bigger cohort. I think the ownership's quite important, isn't it? So it's not just seen as, well, that's something that public health do, or I daren't ask somebody about that. It's about kind of changing that whole culture, that it's okay to talk about this, and where can I get a bit of support? I think with the work we've already got in some of our poorer communities, and the opportunity to, have every contact count through primary care and the hospitals, but it's the support as well to help them sustain it and make those changes, because for some people it's not so easy as just having that bit of information and the one-off conversation. So we've got some real strengths in what we've got in the community, but I'd like to see that grow and develop so that it does change it affects health inequalities, and people talk about it, and it's really owned by the communities, I think.